In clinical neurology, there is a strict inconsistency in how patients lose their hearing. A patient can suffer a massive ischemic stroke, destroying the entire temporal lobe of their brain, yet retain the ability to hear perfectly well out of both ears. Conversely, a microscopic blood clot lodging in the tiny vessels of the inner ear will cause profound, permanent deafness on that side in seconds. This graphic shows the principle of bilateral representation. Unlike pathways for vision or touch, the auditory signal splits and crosses the midline almost immediately at the trapezoid body. By the time sound reaches the cortex, it is processed by both hemispheres simultaneously. Because of this early decussation, the auditory system possesses extreme anatomical redundancy. A single stroke in the higher centers of the brain cannot wipe out the signal from one ear because that raw data has already been duplicated and routed to the opposite side of the brainstem. This roadmap outlines how a mechanical vibration becomes a conscious perception using the mnemonic E. coli ma. It tracks the ascent from the eighth nerve through the cochlear nuclei, superior olive, lateral lemniscus, inferior colliculus, medial geniculate body to the auditory cortex. Tracing this specific sequence of neural relays maps the exact physical stations where the brain calculates the three-dimensional origin of a noise, revealing how it actively filters out the background chatter of our physical reality. The journey begins at station E, the eighth cranial nerve. Here, mechanical sound waves vibrate the inner ear, triggering action potentials in bipolar neurons. These specific neurons are bundled together inside the modiolus, the central bony axis of the cochlea. These electrical impulses travel rapidly along the peripheral processes of the eighth nerve. They exit the in-ear and enter the central nervous system at the pontomedullary junction, the anatomical border between the pons and the medulla. Upon reaching station C, the cochlear nuclei, the raw auditory data is not passed along as a single uniform stream. The signal immediately diverges into three discrete acoustic striae. This diagram details the distinct functions of these processing centers. The ventral cochlear nucleus, or VCN, isolates the exact timing and intensity of the incoming sound wave. Simultaneously, the dorsal cochlear nucleus, or DCN, extracts the specific frequency, or pitch. At the very first synapse inside the brainstem, the auditory system breaks the physical sound wave down into mathematical components. The brain extracts these discrete features to rebuild the acoustic environment from scratch. To determine exactly where a sound is originating from in physical space, the brain needs to compare the data from both ears. Axons carrying timing and intensity data from the ventral cochlear nuclei physically cross the midline of the brainstem via a thick bundle of fibers called the trapezoid body. These crossed fibers arrive at station O, the superior olivary complex. This is the first anatomical site in the nervous system to receive binaural input, with signals from both the left and right ears arriving simultaneously. This matrix demonstrates how the superior olive computes location. The medial superior olive calculates interaural time differences. Because a low-frequency sound wave hitting the left ear takes a fraction of a millisecond longer to reach the right ear, the medial superior olive uses that microscopic delay to pinpoint the sound's origin. High-frequency sounds are processed differently. The human head acts as an acoustic shadow, blocking short sound waves and creating a volume difference between both ears. The lateral superior olive measures these interaural intensity differences to localize high-pitched sounds. By continuously running these parallel mathematical calculations on timing and volume across both hemispheres, the brainstem generates a precise, real-time map of three-dimensional auditory space. With the spatial mapping complete, the integrated signal moves up the brainstem. It ascends via the lateral lemniscus, the primary vertical highway carrying this highly processed acoustic data upward through the pons. The pathway reaches station I, the inferior colliculus in the midbrain. This structure acts as the principal auditory integration center. It's the origin point for the auditory startle reflex, sending rapid motor signals down the tectospinal tract to turn the head toward a sudden noise. From the midbrain, data flows to station M, the medial geniculate body. This thalamic nucleus acts as a gatekeeper, filtering and refining the auditory signal before dispatching it along the auditory radiation fibers, fanning out toward the cerebral cortex. The journey terminates at station A, the primary auditory cortex in Heschl's gyri. This area exhibits tonotopic organization, meaning specific frequencies are mapped physically onto brain tissue, with low pitches activating the anterolateral cortex and high pitches activating the posteromedial cortex. At this exact anatomical location, the mechanical vibration that originally struck the eardrum has been fully translated, mathematically parsed, and spatially mapped, finally resulting in the conscious perception of a sound. Tracing the path from the ear to the cortex suggests a one-way street, where the brain passively receives whatever acoustic information the environment provides. But the auditory system requires an active filtering mechanism to function in complex environments. There is a secondary, descending network working in reverse, allowing the brain to constantly talk back to the ear. Cortical and brainstem networks send descending fibers via the olivocochlear bundle, synapsing directly back onto the physical structures of the inner ear. This flowchart illustrates how this feedback loop drives the cocktail party effect, allowing a listener to focus on a single voice in a crowded room. When the cortex detects excessive background noise, it signals medial olivocochlear neurons in the brainstem to release the neurotransmitter acetylcholine. When this acetylcholine washes over the specific region of the ear receiving the noise, it physically hyperpolarizes the outer hair cells. Hyperpolarization is a shift in a cell's electrical charge that decreases its likelihood of firing. In this case, it causes these sensory cells to stiffen and stop moving, effectively turning off the cochlear amplifier for those exact noise frequencies. The contrast shown here between graph A and graph B demonstrates the result. By intentionally dampening the mechanical receptors tuned to the background chatter, suppressing the clutter dramatically increases the overall signal-to-noise ratio, the mathematical proportion of meaningful data to background interference, isolating the target speech signal. Human hearing relies on dynamic, bidirectional engineering. The brain alters the mechanical properties of the inner ear in real time to prioritize the data it needs. This vascular map highlights the specific arteries feeding the ascending auditory tract. We can verify the accuracy of the entire E-Colima functional model by observing what happens when the blood supply to these precise neural stations is cut off. Because the inner ear is an end organ with no collateral blood flow, an occlusion of the labyrinthine artery destroys the delicate hair cells. This terminates the auditory signal before it can reach the protective redundancy of the central nervous system, resulting in sudden, profound deafness. Further up, an occlusion of the anterior inferior cerebellar artery, or AICA, starves the lateral pons. This destroys the critical binaural mixing stage at the cochlear nuclei and the superior olive. A patient with this specific stroke presents with a classic clinical triad: severe vertigo, hearing loss, and ipsilateral facial weakness. This explains our opening clinical paradox. A massive occlusion of the middle cerebral artery can completely destroy the primary auditory cortex on one side, severely impairing a patient's ability to interpret language, a condition known as Wernicke's aphasia. But it will not cause unilateral deafness, because the raw acoustic data was already copied and sent to the opposite hemisphere, down in the lower brainstem. The auditory pathway operates as a highly redundant bidirectional computer. By sacrificing the vulnerability of its peripheral sensors, it achieves immense central resilience, ensuring that as long as a signal can make it past the inner ear, the brain will find a way to hear it.